Welcome to St. Croix Valley Almanac. Today is March 27th, 2020, and I am your host, Ross Gabrick. With the COVID-19 emergency, many Americans across the country spend more time at home with family and friends, sometimes between essential work, but without social access to places of fellowship. During the shelter-in-place orders to prevent the spread of COVID-19, Cepiaclub offers some useful suggestions to make this time more practical and of real value for everyone. While the emergency shutdown of the country has, as yet, no determined length, and we do not yet know the end game or recovery time from the crisis, we as individuals and families have the opportunity to think and act in constructive ways. These helpful actions apply during the shelter-in-place emergency and for the future that follows after it. We'd like to suggest priority steps to take. Most importantly comes the need for everyone in your household to stay healthy. Of course, keep your household, sleeping, living, working, and recreational areas clean and wiped down and disinfected to prevent cross-contamination of COVID-19 and other germs. In closer living with others, even common colds or worse can spread easier. With the healthcare system in this country soon to be overwhelmed with COVID-19 cases, like in several of major cities and states already, preventative health and health monitoring become absolutely essential. As a practical step, every morning and every evening before bed, all members of a household should take their temperatures. Record these temperatures and times taken in your own personal emergency notebook. Also, monitor personal weights on your bathroom scale, if you have one, and note the dates and all results. Over the course of the days or weeks of the emergency, these vital statistics and any other measurements you can take, like blood sugar for diabetics, pulse and blood pressure if you have the skill and equipment, or listing any odd aches and pains, complaints, etc., will assist everyone in indexing any critical changes in their health. To get accurate interpretation and or warning from your vital statistics, refer to the official medical sites for understanding the data. Seeing potential health risks from health monitoring for a household will help you understand better the need for an improved and balanced nutritional diet. Follow guidance you find from credible online sources or family medical encyclopedias, if you have one. For official medical sites, search for such things as AMA, or the American Medical Association, the American Heart Association, the Centers for Disease Control, the U.S. State Departments of Health and Human Services, and so on. To the extent you can, prevent health risks you can avoid. Doctor visits or hospital testing or stays may not be practical for quite a few weeks or months. During the shelter-in-place orders, everyone can and will develop unhealthy habits, whether from boredom, laziness, lack of grooming and self-care, or spiritual malaise and other dangerous lapses in healthy attitudes and clean living. To the extent you can, even if only doing a treadmill or push-ups, try and get as much exercise. Also, try and get fresh air outside while practicing social distancing. All these measures help to keep you and your family fit and healthy and provide an invaluable help to you and others in overcoming the COVID-19 emergency. Besides self-discipline over habits, diet, exercise, and health monitoring of vital statistics help you stay focused and busy. Activity helps keep up morale. We suggest practical steps for the long haul. Again, the world crisis for COVID-19 provides no easy answer for its length, necessary means, recovery timeline, or definite government plans. Just in case, Cepiaclub encourages everyone to think for the long term, but not necessarily in terms of a worst-case scenario. To keep occupied with practical action, like household diet, exercise, and preventative health, we also offer the following as a guide for short-term preparations with long-term results. These actions, in and of themselves, help Americans keep from the spiritual malaise, boredom, laziness, and anger and resentment that would otherwise make our experience in the shelter-in-place situation more difficult. They keep one occupied, yes, but they will also help with the post-emergency recovery and on an individual and family basis. An example: inventory household food and medical supplies. This will help you prepare balanced, healthy meals, deal with preventative health care needs, and cut down on expenses and other problems if you need to restock before the end of the emergency. Honestly, this emergency may last for a while. No one really knows at this time. Therefore, an inventory of food, medical supplies, and other necessary household items will allow your supply to stretch in the extreme event that you have to ration them. Furthermore, rationing and stretching supplies prevents the need to resupply at stores or relief distribution points where the incident of contact threatens the spread of COVID-19 or any other risks to you and your family. Waste nothing during the emergency. In normal times, Americans could simply replace what they needed, even without fully using their on-hand stocks, by going to the superstore. You may not have that option, or it may pose health risks. Either way, take precautions for that extreme worst-case scenario that you will have to reuse normal recycling items like plastic and glass containers, clean paper products, metal cans and scraps, old clothes for cleaning rags, strings, wood pieces, etc. These have further uses. What you used to throw in the trash may prove important now or later. Store your recycling in a safe area away from family living areas to prevent health or infestation risks, but nonetheless assume that for a period of a couple or perhaps several months, we in America can no longer afford frivolous living and careless waste. As a practical means of reuse, start collecting old non-protein food and other kitchen waste for composting, a means of developing rich soils in pots or backyards for growing delicious vegetables later in the spring and summer. Households should use composting kitchen buckets for dumping in piles outdoors, such items as eggshells, vegetable peelings, leftovers, non-meats, coffee grounds, sugars, pastas, and other carbohydrates do the trick. Not only will composting provide nutrients in the soil for kitchen gardens, gardening has its value as a wholesome and enjoyable exercise or hobby. Not only can you feed your family good homegrown foods during the COVID-19 recovery period if necessary, but households can feel better and work together in doing so. Boost your diet and morale for the emergency and afterward with your very own modern-day victory garden. In conclusion, we face epic challenges in this world. It presents an immediate risk and long-term complications. But don't forget, we can turn this situation into an opportunity to renew our lives and our world to better things. We can, and we must. We hope to take at least some of our suggestions for the COVID-19 emergency shelter-in-place order. They can only help you and your family. Stay tuned at www.cepiaclub.com. That's www.cepiaclub.com for more information during the COVID-19 crisis. God bless, stay safe, stay smart, and stay tuned. Thank you for listening. This has been Ross Gabrick coming to you on the St. Croix Valley Almanac, directed and written by Tim Krenz, produced by Ross Gabrick, Tim Krenz, executive producer. This material is copyrighted 2020 by the Cepiaclub, LLC, and we grant fair use and global commons rights for reposting or rebroadcast. To contact us, visit www.cepiaclub.com.